This presentation is on emergency and disaster risk management, or EDRM, and the framework that can and is being developed to help mitigate health risk and consequences. Why is EDRM important? Disasters that pose a threat to health can occur anytime and spread rapidly. One of the most recent examples we can all relate to is the COVID-19 pandemic that started in China and spread rapidly, causing nearly 7 million deaths around the world. Climate change and inclement weather has also been much more common lately, causing more disastrous events and a greater need for action. Some of the most common types of disaster are infectious disease outbreaks, natural hazards, conflicts, unsafe food and water, chemical and radiation incidents, lack of proper power, air pollution, and climate change. How do we handle the problem? Currently, many of the studies on disastrous incidents focus on response and recovery to save lives, and less on the preventative measures that can be done beforehand. Many of these incidents occur and are most detrimental in poverty-stricken areas. The WHO is committed to working and partnering with member states to develop a framework to help better identify, prevent, and mitigate the health effects of these incidents. The health EDRM guiding principles include a risk-based approach. Risk posed to communities directly impacts the communities exposed to hazards and their subsequent vulnerabilities. By anticipating and mitigating the associated risk, communities can reduce potential consequences. Uh, Comprehensive emergency management, assembling a series of plans for emergency situations with contingency plans in place to address and prepare for potential emergencies. All hazards, rather than creating multiple plans which can expend significant amount of time and resources, create one plan to holistically address potential hazards that could arise. Inclusive people and community-centered plans should focus on the communities they serve, not on certain groups, but rather address the main concerns and issues the population as a whole would face. Multi-sectoral and multidisciplinary collaboration, managing the risks posed by emergencies across multiple groups, such as public and animal health sectors, to address health threats to all groups, not just people. Whole of health system base, focused on strengthening the health among multiple generations. Goal is to improve health, to improve community resilience to disease and other potential hazards. Ethical considerations focus on prioritizing human life. This may include a focus on those with higher levels of vulnerability who may not have access to services that could help them plan on their own. Some more guiding principles are policies, strategies, and legislation, defines the structure, roles, and responsibilities of the government and other factors for health EDRM, including strategies for strengthening health EDRM capacities. Planning and coordination emphasizes effective coordinating mechanisms for planning operations for health EDRM. Human resources includes planning for staffing, education, and training across the spectrum of health EDRM capacities at all levels, and the occupational health and safety of personnel. Financial resources supports implementation of health EDRM activities, capacity development, and contingency funding for emergency response and recovery. Information and knowledge management includes risk assessment, surveillance, early warning, information management, and technical guidance and research. Risk communication recognizes communicating effectively is critical for health and other sectors, government authorities, the media, and the general public. Health infrastructure and logistic focuses on safe, sustainable, secure, and prepared health facilities, critical infrastructure, examples water and power, and logistics, and supply systems to support health EDRM. Health and related services recognize the wide range of healthcare services and related measures of health EDRM. Community capacities for health EDRM focuses on strengthening local health workforce capacities, inclusive of community-centered planning and action. Monitoring and evaluation includes process to monitor program towards meeting health EDRM objectives, including monitoring risks and capacities and evaluating the implementation of strategies, related programs, and activities. Who does disaster affect? Everyone is a potential victim of the threats posed by any of these disasters. Each year, hundreds of diseases break out globally, affecting more than 85% of countries. Recently, with COVID-19, the WHO initially declared a public health emergency of international concern in January of 2020 and a global pandemic in March of 2020. Historically, 190 million people are affected each year, and 77,000 people die as a result of such occurrences. Recent years are likely inflated due to occurrences such as COVID. These events can also leave a large monetary toll, resulting in approximately $1 trillion in damage.
How do we approach the problem? By strengthening health systems, by observing international health regulations, groups are able to focus on creating plans for their communities and these international guidelines will also give them structure for how to set these plans up effectively based on historic usage of these plans. They can develop risk strategies that handle a multitude of disasters such as floods, earthquakes, public spills. Most recently, you'll see the trains that have gone off the tracks spilling chemicals. These plans would help address that, and observing the impacts of climate change and planning accordingly, such as adding different communities into flood hazard areas and preparing evacuations for such areas. What does this approach achieve? By utilizing this approach, they've greatly reduced the consequences of emergencies and disasters, reduced the risks associated with these events and potential lives lost as a result of them, reducing the probability that these events may occur. While this doesn't relate to natural disasters, this does reduce man-made disasters that may occur, and creating stronger health systems based off of lessons learned from the health emergency disaster risk management. How's this approach different? By taking a risk-based approach, you start to resolve a problem before it exists, which ties into being proactive rather than reactive. It's always better to be prepared for what could happen rather than trying to solve what did happen. Events may also have far-reaching or long-term effects. For instance, if you were to only look at a volcano erupting, the immediate vicinity is your only concern, whereas the focus should be on the air quality of a much larger footprint, the potential air traffic disruptions, supply chain implications, and so on. Emergencies are felt by the world and should be handled accordingly. Groups and governments and people need to work together to solve these problems. Everyone's participation is required, and with that comes the ability to build plans that'll benefit the people. If everyone is involved, they can help address concerns that a single party may not address due to lack of knowledge or understanding of the potential problems in a specific area. How do we implement this framework? To develop a strategy and identify priority actions, a risk assessment must be performed, which involves identifying and analyzing the risk of a hazardous event at local, subnational, or national levels, commensurate with the risks posed to the groups. Identify the capacities, which is you need to typically at the beginning of a disaster, an initial assessment will be performed to identify the group's capability towards handling different aspects of a disaster. However, in more extreme scenarios, prioritization of human life is the main goal, and then your capacity is placed towards how do you help people in order of need. So obviously, saving lives is the number one priority of this plan. And then creating a health sector development plan and strategies to address the associated risks. Framework components. Design of the health emergency and disaster risk management strategy should be based on findings of risk and capacity assessments. establishing surveillance protocols, early warning indicators, and setting up alert systems to drive early action, preparing for all event types, and ensuring hospitals and health facilities are properly prepared. Roles and responsibilities. Governments and societies as a whole efforts need to produce efforts. Yeah, sorry. Efforts are required from all groups at all levels to reduce the total health risk and consequences associated with emergencies and disasters. The Ministry of Health takes a leading role in outbreaks and can work across all types of disasters. National Disaster Management Agency oversees management and the coordination of these large-scale emergencies, and mainly tied to hazards. Continue on. Local communities, including members of civil and private sectors, are all responsible for partnering and participating in all health emergency disaster risk management strategies. By utilizing everybody involved in local communities, a focus can be placed on risks that are not widespread. Each individual community would have their own prioritization that's required to address certain risks, which cannot be addressed at a global level. You need to focus in smaller areas where you need subject matter experts that live in the communities to guide you. The World Health Organization, through its governing bodies and senior leadership, support the development and implementation of health emergency disaster risk management across the globe. They serve as basically a foundation to help any group that wants to create a disaster plan, such as local governments, individual communities. They can reach out to the World Health Organization to receive guidance and assistance towards putting together plans that can help their communities. And another group is the UN or Red Cross, which assist at the country level as partners of WHO. So these groups would get involved in very widespread events such as major hurricanes, earthquakes, and so on. So to conclude, there's no country or group that is immune from the emergency and disaster risk from these risks. This can impact anyone from the best economies to the worst, from poverty to rich, and people from all walks of health. Now, certain groups are more vulnerable, but as we've seen with COVID, anyone can be affected by some of these emergencies. Policies and strategies and associated programs are necessary to reduce the risks and consequences associated with these disasters. Capacity development at a country and local level should continue building and improving existing frameworks and programs. Basically, this is a continuously growing program. We can learn from mistakes of the past and prepare for different situations that may occur in the future. The World Health Organization is committed to collaboration with groups across the globe to help develop capacity for health emergency disaster risk management.